Sandy, nerve damage, one hip, and arthritis. Can surgery help? If you have advanced osteoarthritis of the hip, then hip replacement may be needed. If you're mild to moderate osteoarthritis and you have a pinched nerve in the back, Regen Med can help. Possibly PRP for the lower back, possibly bone marrow concentrate for the hip. Ramona, I'm 66 with osteoarthritis. Can I rebuild my cartilage? The best Regen Med options out there for osteoarthritis, if you're talking about disease modifying, is bone marrow concentrate. You cannot rebuild cartilage. You can preserve cartilage, prevent it from progressing by treating the bone. By treating the joint, you can reduce pain. By treating the ligaments, you can help treat instability and improve function. But to prevent progression, you have to inject directly into the bone, which is very beneficial and can help. But to rebuild cartilage, we don't have anything like that in science currently. Boo-boo, do we love mesenchymal stem cells from adult adipose tissue? I graft them into the orbital hollow. Okay, wow, that escalated fast. Okay, so number one, in the United States, I can only talk from the United States perspective. That's the regulatory apparatus I'm affected by. The only true stem cell treatments that we can do come from your own bone marrow concentrate, have to be used from the same person, have to be used the same, prepped and used the same day, and have to be used for joint and tendon issues. All right, those are the rules. Adipose cells, there's an enzyme that's utilized to free your stem cells up from the fat. The use of that enzyme is illegal in America and anywhere else where the FDA has any kind of sway over regulation for medical things. You can take adipose, you can use it for grafting issues, you can use it for structural issues, but you're not allowed to technically break it apart to get the stem cells out. Surgery worth having? It's an interesting question. Normally when you have a bone spur, it means that there's significant instability in an area, either weakness in the tissue, ligament or tendon, or tear in that area. And your body cannot stabilize it, so it just places calcification there. If you have a very large bone spur, it may be beneficial to get surgery. If it's a very small bone spur, maybe not. So this is how I think about it. Let's say you have a bone spur, and under ultrasound, I can look at the tendon and the bone spur, and I say, wow, that bone spur is really impinging things, right? Like it's preventing normal range of motion and actually cutting through the tissue. I think probably surgery would be beneficial. And then afterwards, I would recommend putting your own bone marrow derived stem cells into that area. On the other hand, if there's a small spur and it's more a sign of instability and the range of motion is still good, I think utilizing your own cells, either platelets or bone marrow, without going to surgery would probably be helpful. As a reminder, my name is Siddharth Tambar, expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis, answering your questions every Tuesday, Thursday, late afternoon, and Wednesday morning. This is purely for educational purposes, not personal medical advice. If interested in evaluation, in person or via telemedicine, please email us at admin@chicagoarthritis or direct message us. The Bombic. I broke my ankle a couple of years ago and now have post-traumatic arthritis. Any suggestions? So when I see patients who had prior bad trauma, right, and if they're coming and asking me about treatment options, generally we're talking about bone marrow concentrate. And if there's significant arthritis, it's taking your own bone marrow stem cells, injecting that not only into the joint for pain relief, the ligament for stability improvement, but importantly into the bone around the joint that is severely arthritic to help preserve the bone as much as possible. That's called subchondral injections.